Ireland faces escalating hospital bed crisis. Ireland's healthcare system is grappling with an acute hospital bed crisis, exacerbated by rising patient numbers, chronic underfunding, and staff shortages. This crisis has led to overcrowded emergency departments, long waiting times for treatment, and significant strain on healthcare workers. The Irish Nurses and Midwives Organisation, INMO, reports that hospital overcrowding has reached unprecedented levels, with a record number of patients waiting on trolleys in emergency departments. On any given day, hundreds of patients are left in hallways due to the lack of available beds, significantly impacting their care and comfort. One of the key factors contributing to the crisis is the chronic shortage of hospital beds. According to the Health Service Executive, HSE, Ireland has fewer hospital beds per capita compared to other EU countries. The country has approximately 2.9 beds per 1,000 people, well below the EU average of 5 beds per 1,000 people. This shortfall has been exacerbated by the COVID-19 pandemic, which has put additional pressure on the healthcare system. Staff shortages further compound the problem. The HSE has reported significant gaps in staffing levels, particularly among nurses and midwives, due to years of underfunding and unattractive working conditions. Many healthcare professionals are leaving the public sector for better opportunities abroad or in the private sector, leaving hospitals struggling to maintain adequate levels of care. The winter season traditionally sees a spike in hospital admissions, particularly among the elderly and those with chronic illnesses, further straining resources. This year, hospitals are bracing for a particularly challenging winter due to the confluence of COVID-19, influenza, and other respiratory illnesses. The crisis has prompted urgent calls for government intervention. The HSE has announced plans to increase bed capacity by reopening closed wards and converting non-essential spaces into temporary bed areas. Additionally, efforts are underway to recruit more healthcare staff, including international recruitment drives and incentives to retain existing staff. Minister for Health Stephen Donnelly has acknowledged the severity of the situation and outlined measures aimed at alleviating the crisis. These measures include increased funding for the health sector, fast-tracking the construction of new healthcare facilities, and expanding community care services to reduce hospital admissions. Despite these initiatives, critics argue that the government's response has been insufficient and too slow. Opposition parties and healthcare unions are demanding more immediate and robust actions, such as increasing hospital funding, addressing pay and conditions for healthcare workers, and implementing long-term strategies to enhance the capacity and resilience of the health system. The Irish public has expressed growing frustration with the state of the healthcare system. Recent surveys indicate a significant decline in public confidence in the government's ability to manage healthcare effectively. Protests and campaigns by healthcare workers and patient advocacy groups have highlighted the urgent need for systemic reforms. The hospital bed crisis in Ireland underscores the broader challenges facing the country's healthcare system. As patient numbers continue to rise and resources remain stretched thin, finding sustainable solutions to ensure timely and effective care for all citizens has become a critical priority for the government and healthcare providers alike.